Countries like the Maldives and Bhutan have enacted total tobacco bans, but with a population of nearly 70 million people, this ban in the UK could have serious and long-term impacts. Under the Tobacco and Vapes Bill, the legal age for buying tobacco will increase by 1 year every year, starting with people born on or after January 1st, 2009. This means children in the UK who are 17 or younger will never be able to legally buy cigarettes. The law also tightens controls on vaping, including banning sales of vaping and nicotine products to minors and restricting advertisements and promotions. Of course, this raises questions about whether the ban will last and if one would ever work here in the U.S. And joining me now is Michael Seelbach, Assistant Vice President of Public Policy at the American Lung Association. Michael, thank you so much for joining us. And what is your reaction hearing about this British law?
You know, we believe that any tobacco control and prevention momentum is a really good thing. Tobacco remains the #1 preventable cause of death and disease in the United States, and we need to continue putting forward innovative solutions to reduce the tobacco epidemic.
So what do you think the logic is behind the British approach instead of just an outright ban?
You know, we know, at least in this country, 90% of adult smokers start smoking before they're 21, and 99% of those smokers start before the age of 26. So what does that mean? If we can prevent kids from ever picking up that first cigarette, it's highly unlikely that they're going to start as adults. But what this policy also does is say, if you're someone who's addicted to tobacco, they're not going to make it illegal. They're obviously going to look for tools to help them quit, but it's changing the culture so that it's no longer, well, when I turn 18 or turn 21, that's my time to buy tobacco products.
Is there a concern that this could create a significant black market for cigarettes?
You know, the fact is, every time that any significant tobacco policy goes into effect, there's questions about the black market. And illicit sales are a legitimate concern, and we need to make sure that there are policies put in place to prevent. We don't want to just see a bunch of cigarettes being sold on the street. That doesn't help anyone. We want to make sure that these policies are implemented as they plan to do.
Do you think a law like this would work here in the U.S.?
You know, it's a great question, and you know, it's often hard to think about even some of the laws we have today. If you were to say, 20 years ago, do you think this could have happened? I think things are possible. And we know there's a long history that states and cities are laboratories of democracy. And there are already municipalities in Massachusetts that have passed laws like this one. We hope to see the evidence base and see if this is effective in preventing kids from ever starting to use tobacco products.
What kind of health impact do you think a law like this is going to have over the course of time?
I mean, the fact is that the tobacco industry continues day in and day out trying to develop new products to addict our kids to their deadly products. We need to push back hard. And if this is effective, we may finally be able to cut this addiction off once and for all.
Michael Seelbach from the American Lung Association, thank you so much for your time.
Thanks so much.